President Cyril Ramaphosa has announced that South Africa is returning to level 1 of the lockdown effective from this evening. He says the country has clearly emerged from the second wave of the coronavirus. Under level 1, the curfew starts at midnight and ends at 4 a.m. Gatherings will be allowed but must be limited to 100 people indoors and 250 people outdoors. Night vigils after funerals are still not permitted. Alcohol sales are allowed in normal trading hours but are not allowed during curfew hours. President Ramaphosa says people must still adhere to protocols like wearing masks.
Cabinet has decided earlier today to move the country from coronavirus alert level 3 to alert level 1. The new alert level will come into effect later this evening once the regulations have been gazetted. This will mean that the hours of curfew will now move from 12 midnight to 4 a.m. The second part is that gatherings will be permitted, subject to limitations on size, adherence to social distancing and other health protocols. And these gatherings will include these following types of gatherings: religious, social, political, and cultural gatherings. The other part is that the maximum number of people allowed at any gathering is 100 people for indoor gatherings and 250 people for outdoor gatherings. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used.
President Cyril Ramaphosa also says the vaccine rollout is going very well. He has lauded the various spheres of society for working well together. The president says 67,000 people, mainly healthcare workers, have been vaccinated. Another 80,000 Johnson & Johnson vaccines arrived in the country yesterday. Ramaphosa says phase 2 of the coronavirus vaccine rollout is expected to take place from late April, with the elderly and essential workers among those to get the jab.
The number of sites that will be available for vaccination will be expanded next week from 17 to 49 sites. Of the 49 sites, 32 will be at public hospitals and 17 sites in the private hospital sector. This includes sites in the rural areas to improve access to rural healthcare workers. Once the vaccination of healthcare workers has been completed, we will begin with phase 2 of the vaccination rollout in late April to early May. Phase 2 will include the elderly, essential workers, persons living or working in institutional settings, and those with comorbidities.
Let's now get some analysis from political economist and managing director of Zehuti Advisory, Mandla Isaacs. Mr. Isaacs, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Thanks for having me. Good evening to you and the viewers.
Good to have you on the show this evening, sir. Now, in as much as the move to level 1 was widely predicted and expected in some quarters, what is your reaction to the country moving to level 1?
Well, I think it's welcome. As the president laid out, the number of infections has decreased dramatically from what we saw in the last week of December, the last week of January, to now in the last week of Feb. So obviously, after the devastating loss of life in 2020, as well as the enormous impact on the economy, we're going to want to try to get back to normal as quickly as possible and hope to see a rebound that we can gather optimism from. So that's going to be dependent on the vaccination rollout ultimately, as well as South Africans continuing to observe the different protocols in all sectors of society, because in order to get back on track economically, we absolutely have to keep the pandemic under control.
And speaking of rebounding economically, some people are now predicting that as we are fast approaching the Easter period, some people, will stop taking all the necessary precautions and start being reckless. And now some people are actually predicting that we will then will rather go back to level 1. So in terms of the economy, what does it do?
Well, I mean, this is one of those really complex problems, right? Because it requires citizens in all spheres of life to behave responsibly. One certainly hopes that the virus, as it's made its way through our society, that the levels of immunity are starting to build, and ultimately our hopes have to rest on government really effectively rolling out this vaccination program. I would have liked to see a bit more detail from the president and from the government as a whole. I mean, they've had several weeks. I mean, obviously months of planning, but certainly since they've kind of stabilized around the Johnson & Johnson vaccines, as well as Pfizer, I would really like to see more of a timeline to show us how we're going to get from, where we are now. It's about 70,000 health workers vaccinated to 40 million South Africans vaccinated. Because it's only then that we're going to be able to start to put this behind us, fully open up for tourism, which is obviously a very important industry, fully open our economy to all of those high contact industries like hospitality, conferencing, and others, so that we can really get back to normal.
Will this be a drop in the ocean? I mean, with the easing of some of the restrictions as a result of this pandemic, and will this see, a drop in the ocean in terms of people going back to work and some job opportunities opening up under level 1?
Well, I think we're certainly seeing that we're going to be moving towards a new normal, right? COVID has completely shaken up the way we live, the way we work. Certainly, many industries have rethought how many people need to be on site. Many people who have gone to working largely from home because of the pandemic will continue to work largely from home. Businesses are starting to reimagine their footprint. How much office space do they need to have? But certainly, it's going to be some time before things like sports, concerts, indoor events that require many hundreds of people to be in close proximity. You think about the convention sector, which is a big part of our tourism draw, because tourism is not just leisure visitors, but also business travelers that come for the many tourisms we host as one of the major convention hosting countries on the African continent. So I don't think we're going to get back to where we were before the pandemic. We're going to be moving into a different economy in the future.
So if you would make your own economic prognosis and make your own economic predictions, so how far would the country go in terms of returning back to normalcy and, the economy recovering, and how far should it go before we get into full recovery? Because now that the vaccines have now been delivered in South Africa, more vaccines need to be procured, and they come at a cost. And I suppose then it is a matter of the government borrowing from Peter to pay Paul.
Well, look, I mean, it's a bit difficult to predict without full sight of the vaccination program. Remember, there's two legs to it. The first is, are we going to acquire 40 million vaccines, vaccines to vaccinate 40 million people in this year, in this calendar year, and as quickly as possible within the year? And then there's the logistical exercise of getting all of those jabs into South Africans' arms. So I'm a bit skeptical of whether we're going to be able to pull that off kind of by the third quarter. I think it's something I doubt we're going to get to 40 million people vaccinated by the end of this year. So I think the recovery will be somewhere in between. But I think the optimism should be for us that we've all had to adapt, right? So I think businesses, value chains, industries have started to adapt, except the ones that really have to fundamentally involve face-to-face. But I mean, we've seen huge adaptation. So I think that we're going to be better served this year. Governments had time to adapt in terms of regulations, and we've all made those adjustments. So I think we will see some recovery this year. I don't think we'll get to sort of where we were before the pandemic, But ultimately, to get to, really the type of fast growth that's going to allow us to make inroads into poverty and unemployment, that is really going to take those structural reforms that the president has made the centerpiece of his program.
All right. Mandla Isaacs, great chatting to you. Thank you so much for your analysis.
Thank you.